My name is Chris Bayne. I went to Virginia Tech where I received undergraduate degrees. I then did medical school at Eastern Virginia Medical School in Norfolk, Virginia. I did my urology residency at the George Washington University in Washington, D.C. And I stayed in Washington, D.C. for my pediatric urology fellowship at Children's National Medical Center. My clinical interests really include the breadth of pediatric urology. That includes children with kidney stones, children born with conditions where they may reflux urine from the bladder up to the kidneys, children with urinary tract infections, and children with abnormalities of the genitalia, and specifically boys born with abnormalities where the urine tube opens into a different location on the penis versus the most distal tip. I have a specific interest in children with neurological abnormalities of the bladder. This could be things that they're born with, could be abnormalities like spina bifida. It unfortunately could mean that they've suffered a urinary tract injury, spinal cord injury. It could also mean, unfortunately, that they're born with a central nervous problem such as cerebral palsy. Now, alongside all of these clinical interests, I have training in minimally invasive, laparoscopic, and robotic surgery, and these are state-of-the-art techniques that basically amount to using smaller incisions, sometimes finer instruments, and sometimes robotic technology to do surgery in a different way than we traditionally think about open surgery. And oftentimes for kids, this can mean less pain and a faster recovery. And there's nothing more important than getting your kid back to feeling better again. I came to the University of Florida because really there's a rich tradition in pediatric urology here. And this dates all the way back to when Dr. Dixon Walker was here, his tenure, and he was one of the pioneers in pediatric urology, and he set a very high bar and a standard of excellence. And not only do I want to be part of that tradition, but it's important to me to be at a place where I feel like I can deliver children the best care that I possibly can in the best timely manner that I possibly can. And at the University of Florida, I felt like all those resources were already here. And it spans everything from the operating room, the pediatric anesthesiologists, the nurses that we have in the operating room, the techs, all the way to all the ancillary services such as radiologists, the different technologies that we have and the imaging studies we have, all the way to the division of urology and everything that we have here to make a comprehensive program so that I feel that I'm giving a child the best possible chance that I can.